Welcome to the Bowel Chronicles, where we dive deep into the world of bowel health. I'm your host, Nikki Kilpatrick, and on this podcast we have raw and candid conversations with individuals facing various bowel conditions and illnesses. Through personal stories and shared experiences, we illuminate resilience and courage in the face of adversity. Be reminded that each story is personal and unique. These conversations are not to be taken as medical advice or to replace guidance from a doctor or healthcare provider. Our aim is to inspire and empower through these amazing stories, amplifying voices often unheard. So join us as we embark on this journey together. Sit back, listen, and be inspired. Enjoy the episode. Well, hello everyone, and welcome to another episode of the Bowel Chronicles. I'm your host, Nikki Kilpatrick, and today we're joined by the lovely Fiona in Scotland. Fiona, you are very welcome here today. Fiona, your journey I've been following on social media, and it's a journey that kind of intrigues me because you're one of the elite. You're one of those women who I class as a double bagger. And in the world, in our bowel community, that means that you have two forms of a stoma, one being your colostomy and the other one being a urostomy. And I know we were chatting there just before we hit record, and you're not even a double bagger, you're something a little more, which we can get to. But maybe if we just go back to kind of the start of your health journey, your bowel journey, whenever problems started to arise. And I know you have a diagnosis of EDS, Ehlers-Danlos syndrome, and slow dysmotility in the bowel or whatever. But take us back to kind of where things started for you to kick off.
So I was actually diagnosed with bowel dysmotility in primary school. Okay. So I've got a urostomy as well as a consequence of the Ehlers-Danlos. And at the same time, my bladder stuff started becoming evident. They were doing scans and tests and stuff, and I was diagnosed with slow transit constipation, bowel dysmotility, whatever you want to call it.
Yeah.
I think before my 10th birthday.
Okay.
So I guess that's where it started.
Right. And was it a case of your bowels were moving, but moving very slowly, or was it a case of like you were not getting anywhere? I know some people over the years of my health, I would have had periods where I wouldn't have gone for 2 weeks, which was my normal. Then I would have gone for 10 weeks and not gone. And then as time progressed, it just got longer and longer until it stopped. What was it like for you?
It pretty much that. Like as a kid, it was slow, but like I still went like just not as frequently as you're meant to. Mm-hmm. And then as things progressed and as like I got sicker and meds got added in, which didn't help anything, it kind of slowly went from not as frequently as you should do to that's kind of infrequent to okay, right, I can't actually remember the last time I had a bowel movement now. That's probably not a good sign.
Yeah. Okay. And what were their form of treatments? Because you're saying there, medicine was introduced. What was their form of treatments at that stage?
Well, the medicines were more things that were introduced for my bladder, for my stomach and stuff that affect the bowel. So so buscopan's a great one that will make slow transit constipation worse, but was so needed for other things. But medication for my bowel, I was put on laxatives again at about 10, which I will admit I didn't really take very frequently because they tasted foul. And you know what 10-year-olds are like. You're not going to make a 10-year-old take something that they don't want to take.
Yeah.
Other than that, I've done pelvic floor physio, Peristeen, and I think that's about it. It was just medications, the sort of normal laxatives, Prucalopride. Yeah.
Okay, so those are all things to try and stimulate your bowel. You talked there about Peristeen. So for our audience who are listening and maybe not aware of Peristeen, do you maybe want to explain what your version of was? Because it might be slightly different to what I used.
So Peristeen is essentially a rectal washout. It's a really sort of high dose, I suppose, enema, where you can put up to I think it's up to 100 mil, not 100 mils, up to a litre
Yeah,
of warm water into your rectum, and it's to stimulate peristalsis to try and like trigger your body to eject the water, and with it to eject the poop.
yeah, yeah. And did you find that that was effective?
Nope. It did literally nothing. I had issues with the sphincters in my rectum as well.
Mhm.
So as well as my there not being like the sort of contractions there needs to be to move stuff,
Mhm.
they're also what's the word? It was paradoxically tightening when it should have been relaxing. So like my body had no idea what it was doing. So I'd
Yeah,
quite often not be able to pass any of the water from peristeen. So I'd be like, okay, cool. I'm now full of water. I feel even more full and uncomfortable than I did before I started this.
yeah. I think Peristeen can be very effective. I used it for 3.5 years myself, and it was just that whole idea of sitting on the toilet for maybe an hour and a half or 2 hours to get nothing in return. And I
Yes.
think in a position of where there is no peristalsis in the bowel, and it's been prolonged, you're putting in all of this water, and because the colon contents are so dried out, it absorbs the water and doesn't release the water then. So I would maybe get a trickle out. And I actually remember being on the phone to a colorectal nurse, and she asked me how much I was pumping in, and I said, well, I can pump in up to 12 litres of water. And she just was horrified. And she said, what do you mean? And I said, well, I can pump in 1,000 mils, a complete bag full, get a trickle out, and basically go again. And I can repeat that 12 times and literally get no feces out of my bowel at all. And it was at that stage she said, alarm bells are ringing. You're at risk of perforating your bowel from below. Please stop and do not insert any 1,000 mils. And very shortly after that, then my consultant just said, stop Peristeen, because it's evident after 3.5 years, it's doing nothing. For 3.5 years, you've been trying to remind your bowel to, the, to get the muscle to work for peristalsis to kick in, and it's not going to return now. It's been gone for 3.5 years. So
Yeah.
that's just kind of my side. You're saying it was ineffective for you. I know the
I
same for a lot of people, but
I also had the issue that at that point that I was doing the peristeen was when I was listed for my bladder removal, and the
okay.
peristeen was kicking off the bladder spasms, which were then meaning that I was like literally in bed for like 3, 4 hours after the peristeen, like crying because my bladder was so bad. and
Mhm.
and it was what you're saying, like spending days doing peristeen, which is like a 1, 2 hour time sink in your day,
Yeah.
to get absolutely nothing out, to be in even more pain for hours after it wasn't a viable long-term option.
It's soul destroying, and I hear it's used in a lot of children, and that's just, I think for some kids they just feel violated whenever a parent has to kind of administer it and
Yeah.
do it, and then to not get anything out or cause more pain and discomfort to their children. It's just soul destroying. Yeah, it really is.
I
So
feel like everyone views stomas as like the worst case scenario,
mhm,
but realistically, it takes me what 5 minutes to change my colostomy bag once a day, because like it helps in the morning. I change it in the morning, and that's me done. Compared to an hour and a half, getting no results, like feeling even worse.
mhm. And are you like me? Because when I still empty my stoma bag, I'm like, oh my goodness, I'm actually pooping. Like I'm doing this. It's only empty a
Yes.
bag, but I can do this because
Yeah.
for so long there was absolutely nothing.
Yeah, if like something's happened, I'm on medication that like makes me backed up and I don't have output for a day. I'm
Mm,
like, how did I do this for weeks on end? I feel miserable.
yeah,
Like, I feel miserable and bogged down. Like, how was this my life for like weeks on end?
yeah, and it impacts everything because that your bile is completely full, completely backed up for weeks on end, months on end. In my case, it was years, and those gases, those toxic gases, are releasing out into your liver, your kidneys, the rest of your body, and your body just starts to slow down? I know the fatigue is just ridiculous with it, and you can't explain it unless someone can relate and has kind of walked a similar journey to you and
Yeah.
really gets what fatigue is. Yeah. So your bile was slowing down, your bladder was slowing down. Was that all typically related to the Ehlers-Danlos syndrome?
Yeah.
Yeah.
My stomach's also doesn't work. That's why I've got a gastro-judge feeding tube. So it's sort of just, it's all the smooth muscles because they're made of connective tissue.
Mhm.
They all seem to sort of fail in a very similar way that they stop contracting, they just stop functioning.
Okay. So at what stage, let's talk then about kind of timeline. At what stage did you have your colostomy, your urostomy, and your, I can't say that big long word. I call it
Yeah,
JPEG. JPEG's not the right thing for it, is it?
JPEG, it's a GJ. Just call it a
GJ.
GJ tube.
Okay. What was the time scale like for those?
So I actually had the very first thing I got was a suprapubic catheter, which is a surgical catheter.
Hmm.
So I got that at the end of 2016. And then my GJ at the end of 2017.
Wow.
Um, Urostomy was April 2001 and colostomy was September 2002.
Very long.
So, and in amongst that, there was also a nasal feeding tube for 9 months. So, I think I realized that in like 6 years, I went through six different medical devices.
Hmm.
And like sort of six iterations of, okay, right, now I need to get used to my body with this thing. Okay, right, that's changed. I need to get used to my body with this thing.
Hmm.
So over about, so from 2016 to 2002, that happened six times.
Yeah. Mm. That's absolutely crazy. Well, what was that like as a young woman? Were you working? Were you studying?
I wasn't working, or I was sort of studying. I actually moved to Scotland to go to uni and
Hmm.
didn't complete my final year because I got really sick at uni. I did a second degree via distance learning, which I actually did the majority of from hospital.
Wow.
So, like, amongst a lot of the sort of surgeries, so my suprapubic surgery, the feeding tube saga, I was studying distance learning during that.
Hmm.
And like, I have absolutely no idea how I managed to like get myself up doing research, writing a paper, and got a first class degree for a year I barely remember. I was so ill. It's actually kind of comical. I'm not sure I could do it now that I'm better.
Yeah, but I suppose it gave you something to focus on during the midst of that. Yeah.
Yeah, it really helped for long, drawn out hospital admissions because it was a reason to get up, to sit up, get dressed, and do something. It broke up the days.
Yeah. So, like relationship wise, how have you handled that? Has that been a shock? Were you single? What was the crack on that view?
So I'm married now. I've been married for 2.5 years.
Right.
I met my husband when I had a surgical feeding tube and a surgical catheter. So the stoma bags came after after the relationship, but before the marriage.
Hmm.
And I took the approach of just being brutally honest from the get go. I kind of figured I'm also a wheelchair user and use crutches. Like, so I've got other stuff going on,
Yeah.
and I didn't want to be in a situation where like I got to know someone, I really quite liked them, and then I was like, oh yeah, by the way, I've got these two medical devices, and they were like, yeah, no, that is a step too far for me. That I'm really not into that,
Hmm.
which is fair enough. People are allowed preferences, but I didn't want to get in a situation where I liked someone and the thing that ended it was the devices because I didn't want that mental load. So I was pretty honest from the get go, and my husband, way he phrases things is he's always viewed the medical devices as a bit like a weird mole. It's one of the least interesting things about me. It's there, but it's just there,
Good, good.
which I quite like.
Yeah, yeah. And as you say, you're better off kind of divulging all of that from the get-go rather to go to build a relationship up with someone and then be disappointed and heartbroken because they weren't accepting of who you are and your medical
Yeah.
choices. Yeah. That's amazing that you have that support behind you. And he is just accepting. I think that really that just makes a relationship, I think. And
Yeah.
obviously he's a keeper. And how how do you manage on an everyday life, because you're living with not one stoma bag but two stoma bags, and then you have your feeding tube. Technically you're, what is it, a triple ostomate?
Yeah.
Yeah. How do you cope with that?
I get quite a lot of help because of the Ehlers-Danlos. We get Karen once a day that helps with a lot of stuff, and Martin, my husband,
Mhm.
helps with my meds and setting out my feed. So I'm really lucky that I get a lot of support with it. I think if I was completely on my own, I would really struggle.
Okay.
But again, it's easier, as silly as it sounds, it's easier than not having the stoma bags, because changing a colostomy bag is a 5 minute mission. It's much quicker and easier than doing Peristeen. My SPC catheter was getting changed under general anesthetic towards the end. So that was a mission. It was hospital as an anesthetic. It was pre-op. It was the side effects of that, never mind the pain, compared to the urostomy bag that I changed twice a week, and that's me done. There's no hospital. There's
Mhm.
no admission. Like, it sounds like a lot, but when you actually compare to what I was doing before I got the stoma bags, it's actually a lot less work.
Okay. And then, like you're mentioning there, you only do a bag change for your urostomy twice a week. Was
Yeah.
that did your urostomy come about? Did you ask for that because of all the complications with the suprapubic catheter, or was that their suggestion?
It was their suggestion, and I went into the appointment literally not thinking for a second they were going to suggest removing my bladder and putting and doing a urostomy. So
Mhm.
when the surgeon's like, "So, you're not really getting on with your SPC. Do you want to keep it?" I'm doing a bit of a yeah, because urethral catheters and intermittent catheters were agonizing. Like, I'm not getting on with my SPC, but that was 8 times worse.
Mhm.
And I'm sort of like, please don't take this away from me. Please don't take this away from me. Please don't say that, like, crazy young female. And he
Yeah.
goes, yeah. And I'm like, no, no, no. I mean, it's fine. It's fine. I really don't want to go back to urethral catheters. And he sort of looks at me and goes, oh, no, I'm suggesting we remove your bladder. And I'm like, oh, right. So like I went into that appointment completely blind as to like that was what was going to get suggested.
Okay. And did you have any idea what a urostomy was? Having the suprapubic catheter, had you done some research on that, or?
Yeah, I have a couple of friends who'd already had them formed who had the same bladder conditions as me.
Mhm.
So like I knew they existed and I knew they were an option, but you know that way that you always feel like your stuff isn't as serious as other people. So it's like, but they needed a urostomy because their situation was so much more serious than mine, so it would never be relevant to me.
Wow. Why do we do that to ourselves? I think, is it a female thing?
I don't know, but I know almost everyone I know who is ill does that to themselves.
Yeah. Yeah. I think we always have that viewpoint of there's someone else out there in the world that is way worse off, which is true. But sometimes we
But we
need to
don't,
give ourselves a little bit of credit of what we have been through and what we are going through.
yeah, and we don't do that for happiness. You don't do that, well, you can't be happy because someone else is happier.
Yeah. Yeah. True. True. So you get a little bit of support then. You have some carers coming in to help you through the day,
Yeah.
which is good. So from a mobility point of view, you're saying there you're a wheelchair user as well and you use crutches. How Talk us through a little bit about that.
So the Ehlers-Danlos makes my joint sublux a lot, and I'm just not very steady on my feet, and a bit wobbly. So I'll use crutches for really short distances, like getting to and from the car. And
Mhm.
much beyond that, I use my wheelchair. we moved into a bungalow August last year, which has been brilliant because it's all on the same level. I can get into everything. And but yeah, it's quite
Okay.
common with Ehlers-Danlos to have mobility issues because it affects the ligaments and tendons, which makes sort of stability in your legs pretty difficult.
Yeah. Yeah. And as time progresses, do you feel that it has worsened with
Yeah.
time and with age, than kind of where it initially started? Yeah.
Yeah, though I kind of feel like it's sort of petered out to like, not that I want to tempt fate, but it's sort of, at least with the mobility thing, I feel like it's sort of petered out to a sort of level now.
Mhm.
Like it is what it is, but it hasn't really changed for a couple of years now.
Okay.
And I can live with what it is now. Like this is livable. I'm sort of hoping that it's done it, it's petered out, we're at like the level and that's where it's gonna stay.
Okay. And was it hard to get a diagnosis? I know they don't in Northern Ireland here, they don't diagnose. You have to go to mainland UK for a diagnosis.
Yeah, I ended up going to London for a diagnosis, just because I had absolutely no luck up here.
Hmm.
I think it's got a little bit better. There's a doctor in Edinburgh now that sees EDS patients, but I was diagnosed, it'll be 10 years ago in this coming March that I was diagnosed, and there was just nothing here
Hmm.
other than we had an EDS clinic and the doctor retired, and the specialist physio who was part of that clinic was seeing me at the hospital, and she was the one who was like, you need to get diagnosed, like based on the complications you are having, you need to get diagnosed, so when this goes wrong, like you know what's happening.
Hmm. You've been through the mill and you continue to go through the mill because there are some complications with your feeding tube. You're currently back and forwards, you've been sent there to the hospital for some treatment. So it does have some complications. How do you manage on that side of things?
Sorry, I'm just trying to get my laptop charger because I've just got the dreaded battery dying warning.
Okay.
The feeding tube has actually been relatively complication free. I had a bit of a spat in the summer of the extension that goes into my small bowel flipping,
Yeah.
which made the feeding tube essentially useless, but that seems to have settled down. And like it, and you cope with going to the hospital backwards and forwards. You don't really have a choice other than to cope with it,
Mhm.
and because the alternative is being inpatient the whole time.
Yeah.
And like anyone who's been inpatient in hospital for more than a couple of nights knows that you will do pretty much anything to avoid a like, because restarting the treatment last Friday, I would have had 3.5 weeks of being inpatient for what's essentially a 30-minute infusion once a day.
Hmm.
So
And
as
how
much as
many
it's,
days then?
pardon?
How many days do you have to go back and forwards to the hospital for your treatment?
So it's a 14-day treatment, but and it should have finished on Tuesday,
Hmm.
but because it wasn't working very well, they decided to increase the dose last Friday, so it goes back to 14 days from last Friday. So I've still got another week left.
Hmm. Okay. And that's a bit of a hassle and traipsing backward forwards to
Yeah.
the hospital, but that's not something that happens all of the time. It's just been one minor hiccup, has it? Or is that just
Yeah. Oh no, that's a minor hiccup. We've
yeah,
not had to do this before.
yeah.
In compared to before my stomas, when I was at the GP kind of every week dealing with infections or needing more pain meds or needing more laxatives. I'm barely at the GP. I barely see my colorectal surgeon. I've got a great setup with him that I email his secretary if I need to talk to him. He'll get in touch with me within a couple of weeks, and other than that, we don't have contact,
Okay.
which works so which sounds bad, but like it works so much better. There's no point in me dragging myself to the hospital every 6 months if the catch up is there is nothing to say, everything is fine.
Yeah, yeah. I get that, yeah. So your colostomy then, is it permanent or reversible?
It's a loop colostomy at the moment. Um, so it's not permanent, but I have absolutely no intention of ever reversing it.
Yeah. Okay. Okay. So will there be then a future conversation about making it permanent, or do you think they will just leave you unless there's some issues?
We've had a talk about it, and I just don't. I had quite a complicated time after my colostomy. I ended up being readmitted with bowel ischemia and sepsis and spending a weekend in HDU.
Yeah.
And I'm just not ready to have more surgery that isn't like my stoma being an end stoma will not improve my life enough for me to be willing to go through more surgery right now.
Yeah.
So, whilst it's something that would be useful because I'm having issues with backflow from the loop down into the distal loop,
Mm-hmm.
and like it's something that would probably does need to be done at some point, I'm just not in a position to do it right now.
Yeah. Yeah. That's totally understandable given you've got so much else going on. Yeah. So all in all, Fiona, would you say that being this side of surgery, colostomy, urostomy, and your feeding tube, that life is better and there's
Life
definitely
is
better quality?
it's literally life is beyond that I could have fathomed when I didn't have my stomas. We were in Disney last year and this year, which is unreal. And sort of going on the rides before my stomas, I wouldn't have been able to wait in a 30-minute ride queue because I'd have needed the toilet. I'd have been too uncomfortable. Like I just wouldn't have been able to do it. And we've got back to going to live music, which again I just couldn't do before the stomas because it was being a wheelchair user. It's too difficult getting out of the crowd to the toilet, back to the seat, out of the crowd, over and over. So
Mhm.
I've got all these wonderful things back in my life
Yeah.
that I didn't even dare to dream of getting back when I got my stomas done.
Yeah. And do you then avail of the disability access whenever you're at the parks for queuing and the likes of live music? Do you avail of that or?
Yeah, I cannot rate. It's obviously only the venues we go to in Glasgow,
Mhm.
but the access staff at the venues we've been to this year have been absolutely brilliant. Like, I really cannot rate them enough. And yeah, just generally, they have all been wonderful and helpful.
Mhm. Good job. Well, you seem to be thriving, and I just want to hit it a little bit on your social media. Your social media handle is the Forgotten Ostomy. Why did you choose that title for your social media?
That was when I just had the urostomy and before the colostomy was really being spoken about.
Yeah.
And because beyond urostomies are the forgotten ostomy, the
Mhm.
number of times I've had to explain to medical personnel that I have two and they don't is you get the well, why do you have two? Like you can only poop in one place. I'm like, because one of them is for urine. It's like, oh, that doesn't. I've been told by medical person, like people in the hospital, that doesn't exist. And I'm like, well, it clearly does. It's stuck to me. And you've got brands bringing out brand new stoma bags and new colors of stoma bags, and they never include urostomies in it. I can think of like three brands off the top of my head that don't have a urostomy version in their like biggest, sparkliest, newest range
Yeah.
because I think we only make up something like 3% of ostomates, and companies just don't really seem to think we're worth putting money into sometimes.
Yeah. Well, yes, I totally get why the Forgotten Ostomy is your handle. So Fiona's social media handle will be tagged here below in the show notes. So do give her a like and a follow there on Instagram. You do share your journey, which is amazing. And I think, again, you'd be commended because you do show you just air it all there, exactly how you are and what you have and what you're going through, which is an inspiration to everyone. And I think it's really, really important. Like you say, ostomates with those with urostomies only make up 3% of ostomates, which is a small, small minority. And I can remember before I was even looking at stomas, I wouldn't have known what a urostomy was. And I'm someone who's always dealt with um, UTIs and severe UTIs and kidney issues. And you would think that that would be something that I would be aware of. I remember even thinking, what is a suprapubic catheter? I know what catheters are, and I've been with a catheter for like 10 weeks at a time. but I had no idea what an SBC was. So I think the more publishing and publicizing that we do on social media gets the awareness out there, because there will be someone else like yourself going through a journey, maybe an EDS journey, and they will totally be able to relate to what you've gone through, and you will just inspire them. So keep up with the social media. I think it's amazing. And do you find it's a form of therapy, sharing your journey on social media?
Yeah, and I find when everything's really overwhelming, like you can get really useful advice.
Mhm.
So in a way that I have a really great stoma nurse,
Mhm.
and like I can't fault her, but same with the team that look after my feeding tube, they're great, but fundamentally they've never had a stoma and they've never had a feeding tube.
Yeah.
So whilst they can give you the medical advice, they can't give you the okay, right, I'm worried about doing this thing. Has anyone been to this venue? Does anyone know where the disabled toilets are? Are they like close enough to get to if anything goes wrong? Like it's social media and it's sort of the stoma community that gives you those advices
Yeah.
out with the kind of medical clinical side of it, and the peer support is so much to is as important if not more important than the clinical support.
Mm. Yeah, I get that. I felt before I had my surgery, I felt like there was no one out there. I couldn't get in contact with anyone who had a similar journey to myself who could relate. But the moment I had surgery, there were so many people that were like, oh, yeah, your story's the same as mine. And they just got it. They could relate. And that's the joy and the power of social media whenever depending on what context you want to use social media. I used to stay away from it. I didn't like it because I found it negative. But then when you use it for a different purpose, I suppose it has a whole different meaning. And our community, the Bowel community is an amazing community. Those people just want to get alongside you and encourage you and build you up. So I think for anyone that's listening today, that feels alone, just go into Instagram, Facebook, TikTok, whatever, and put in hashtags with whatever it is you're searching and you want to know about, and you will find multitudes of us there sharing our journeys. It's really, really important to do that.
It's almost
Sorry, go on ahead. You're going to say something.
it's almost how I someone I know and the physio suggested I might have Ehlers-Danlos syndrome, and it was searching EDS and Ehlers-Danlos hashtags
Mhm.
that actually made me start going, oh wait, that makes a lot of sense.
Yeah, it's all about the algorithm, isn't it? Yeah, and what your phone holds so much information, so the things you're searching, it will start populating. But
Yeah,
I think going back a few years, nobody knew why we were doing these hashtags. Nobody knew what they meant. And nowadays, I see a post and there's no hashtag on it. I'm like, who do you want to reach? You're not going to reach anyone. You need to get your hashtags in there. So, I have to really think about who my audience is and who I'm targeting, who I want to help, who I want to inspire, who I want to influence, and make sure you get the right hashtags on there. And again, it comes to the same as when you're doing a search and you're trying to find someone else who can
yeah.
search for. Fiona, before we wrap up today, I always ask my guests if there was one little golden nugget that you could share with our audience today. Maybe there's someone on a similar journey to yourself. What would that piece of information be?
I'm trying to think.
You're all right. It might be something you've never.
I suppose actually just as simple as it does get better,
Mhm.
even in like the darkest of days when it feels like it will never get better, it will eventually. Like we have all these years of horrible treatment and horrible procedures, but it does get better at the end.
Mhm. I agree 100%. There's always light at the end of the tunnel. And
Yeah.
there's a wee plaque here sitting in front of me, and it says you don't have to see the whole staircase, just take the first step. And I think it's really apt. Yeah. Fiona, thank you so much for coming along today, taking time out of your day. I know you're exhausted. You have been back and forwards to the hospital for weeks now, having some treatment done. But we really appreciate you taking the time out and sharing your journey with us today. If there is anyone listening and you do have some questions, as I said, go down below the show notes there and follow Fiona on social media. If you have a question, maybe pop her a question or pop it through to me and I can get you the answer certainly from her. If she is up to your eyes or exhausted and can't respond to you, but we definitely will get back to you. So thank you so much, Fiona. It's been good to speak to you. Do tune in next week, guys, for another episode. But from Fiona and myself today, it's over and out.